Hello and welcome to the final episode of the Meet the Expert season on the Talking Locs with Locitude podcast. I am your host, Ade Balogun. Now, this episode was meant to be published in November of 2021. I apologize, but I went on a small adventure and left my laptop on the plane. It's taken a few months to get it back, and I'm happy to have retrieved the master recording. And now I'm happy to wrap up this season and take the podcast to the next level. In this episode, we'll be speaking to Dr. Shakirat Gold-Olufadi, a dermatologist, physician, and a genitourinary medicine specialist practicing at the University College Hospital in Ibadan, one of the oldest tertiary hospitals in Nigeria. She is also a health advocate on social media. She gives us an in-depth medical view of dermatology as it relates to hair and helps us determine when it is necessary to seek medical care with regards to issues that we may face with our hair and scalp. She also gives us a broad perspective on common issues one may face with their hair and how to handle them. Well, without further ado, let's hear the doctor talk. Hi Shakira, welcome to the Meet the Expert series of the Talking Locs with Locitude podcast. It's such a pleasure to have you on.
It's good to be here, Ade. Nice to be here with you today.
All right, thanks. Can you quickly please tell us a little bit about yourself and your practice so that we can get into the juice of the conversation?
Okay, so my name is Shakirat Gold-Olufadi. I'm a dermatologist and a physician in Nigeria and a genitourinary medicine specialist. So this just refers to somebody that takes care of diseases of the skin, the scalp, the hair, the nails, and sexually transmitted infections, and also someone that takes care of diseases that are related to the adult body, okay? That's what a physician is. And again, I presently work at the University College Hospital in Ibadan, which is one of the oldest hospitals in Nigeria, tertiary hospitals in Nigeria.
Awesome.
And presently,
go on.
Presently, I do a lot of, same with what Ade is doing, I do a lot of health advocacy, talking about the skin, the scalp, on all my social media platforms, which is one of the CSR that I do, kind of.
That's awesome. I'm really happy to speak to you today because when people think about hair, it's usually in isolation and it's always from a stylistic point of view. In my experience so far as a loctician for about 6 years plus now, I've noticed that the hair, when your hair starts to thin or when you start to see issues in your hair, it's usually an indication that something is wrong from the inside. And on previous episodes in this series, we've talked to a trichologist, we've talked to a psychologist, we've talked to a nutritionist, and we've made all these connections. So I think the best way to start this question is, what exactly is the difference between a dermatologist and a trichologist?
Okay, so for a dermatologist, like I told you, a dermatologist will treat the skin, the hair, the scalp, and all the disorders that are associated with it. A trichologist, on the other hand, takes care of just the hair and scalp disorders.
Okay.
Most times, for you to be a dermatologist, so let me just say that a lot of times the dermatologist performs the dual function of being a dermatologist, and when it's time to treat the hair, also a trichologist, because the training includes the treatment of diseases of the scalp and the hair. And most times the trichologist actually focus more on the hair itself. So, and for a dermatologist in anywhere in the world, you have to be a doctor to be a dermatologist. You must be a doctor, and then you would have gone through postgraduate training to be a dermatologist. On the other hand, it is not all trichologists that are doctors. Okay, so a trichologist can be a doctor, but most times they are not. So in essence, what I'm trying to say is that the trichologist limits to the hair and the scalp, and they would have gotten training to be able to do this. Okay, so anything that has to do with hair, the scalp, issues. That's what a trichologist does. While a dermatologist goes into the skin, the nails, the hair, the scalp. So the scope is wider. And the dermatologist always has to be a doctor.
Okay, fantastic. Now, when it comes to the hair, okay, so I'm happy that you're a lockhead yourself. How many years has it been now?
Whoop, 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 whoop. It's been 2018, yeah. So that's 3 years now. 3 years plus, because I started March 2018.
Wow. Time really goes by so fast. I remember when your locks were like really tiny and you were always anxious and like, worried and taking pictures as well, which I always tell people to do, like take pictures so that when your hair finally grows, you can see the difference.
You know the thing was, so I think it was just more of finding someone to rant to because I knew the process, and I wasn't surprised that it would take the regular time for my hair to just catch up and all that. But that stage of having those tiny things on my scalp, I just didn't like it. So I wanted to rant to you then.
Okay, so awesome. The reason why I brought up your hair is because oftentimes when people decide to lock their hair, they believe that they have changed what is going on with their hair. So therefore, the normal things don't apply. You oftentimes hear things like, oh, when your hair is locked, don't wash your hair. Don't use conditioner. So my question is, locking your hair, does that make it different in any way from a scientific point of view with regards to the hair and the scalp and the skin?
So let me put it this way. And I was telling someone recently, your hair is still your hair. Whether it is in locks or whether it is whether you leave it out there or whether you put it in cornrows, your hair is still your hair. The only thing is that normally, the hair on the scalp, if you actually counted on the average, we usually have about 100,000 hairs. That's a lot, on the scalp. So normally it is part of the normal phase of hair growth. Normally your hair should shed. About 50 to 100 hairs, you lose them every day, every single day. And you increase the number when you comb your hair the wrong way, you keep combing your hair really dry. You increase the number when you keep doing some funny hairstyles or when you keep pulling your hair. And so for dreadlocks, you realize that we don't comb our hair. Mm-hmm. So that's the reason why it seems like, oh, your hair is growing so fast. All those 50 to 100 hairs that should be lost every day, we're not losing them.
Right.
So that's what it's been, incorporated into the dreadlocks. And at the end of the day, so whether it's been lost or not, it is still your hair. And so there's no reason to say, oh, when you have locks, it's not your hair or it takes care, it's different from. No. The only thing is that, of course, maybe the way you care for it, the kind of products you may use or something, and even at that, if you don't have some diseases of the scalp or the hair, mm-hmm. You really, because when I first started locks, there was nothing I did not hair. You can't put this on you can't put conditioner, exactly that one. You can't put conditioner on your scalp. You can't, maybe in the early stage, of course, that may apply because you want your locks to set in and all that. But the kind of myths that people associate with dreadlocks, there are a lot of myths out there that are not really correct. So your hair is still your hair, whether it's in locks or whether it's all combed out or in cornrows. There's really no difference. The major difference is the amount of hair you're supposed to be losing, which is not being lost.
Okay, fantastic. Now, I would say we've established what the role of a dermatologist is when it comes to hair and scalp issues. And most times, many people don't even think about it. Many people will always come to a stylist first when they start to see issues with their hair. They don't. It's difficult to make the connects because when you think about dermatologist as a Nigerian on the average, you're thinking about your face. Apart from your face, you're not thinking about anything else. So it's interesting to know that a dermatologist is an expertise to seek when you have issues with your scalp. Now, I want to speak about some of the general issues that people normally have and when we should actually sort out a dermatologist. Let's start with the issue of dry scalp. Most people have like dry, itchy scalp. That's usually the basic complaints that you have. So my question is, from a medical point of view, when you have dry, itchy scalp, what's the best way to treat, and what is your body trying to tell you? Is this a reaction to something that's going on inside, or is it just topical and just maybe put some oil on it and you'll be fine?
So it depends on the degree of dryness. So if you just have dryness, so most times, and that's why even in Nigeria, at the Nigerian Association of Dermatologists, we are trying to do something where you mentioned something now that when you have scalp issues, hair issues, most people present to the hairstylist first. And that's because a lot of them, in the whole of Nigeria, we still have less than 250 dermatologists.
No way.
So it's natural, in a country of close to
200
million people. Yeah, so we still have less than 300 dermatologists. In fact, and that's me stretching it. And by dermatologists, I mean people that have completed their training, that have completed their residency training. So when you have dry, itchy scalp, that can happen to anyone, especially when you're not taking care of your hair the way you're supposed to take care of it. You are allowing, and on the contrary, a lot of people, what they do is that they keep on piling a lot of products on their hair, keep on piling things on their hair. And in that process, they start to get a lot of debris, a lot of dirt in their hair. And after that time, this debris can become sticky on the scalp and it becomes flaky. But that's different from somebody that is not piling products on the hair. So when we're talking about dry scalp, we can talk about it in terms of just you have a generally dry scalp, what you need to do at that time is just, oil your scalp. There are a lot of essential oils mixed in some other oils that you can use. Okay, a lot of air, some of those, and one thing that is important that a lot of people fail to realize is that moisture is very good for the hair. So water with some of those oils, you spray them on your hair, your scalp, and you are fine. For a lot of people, they're fine with that. But when you now have dry scalp, where you have some adherent scales, that is usually very itchy and it's always flaking all over the place, then it may be a sign of something that is just more than the ordinary dry scalp. A good example is something we call seborrheic dermatitis. Seborrheic dermatitis is what we generally refer to as the layman calls dandruff. So a dry scalp is different from dandruff. So if you have a dry scalp, does not necessarily mean. So okay, let me put it this way: dandruff can cause a dry scalp, but not all dry scalp is due to dandruff.
Right.
Yeah, so if you have just a dry scalp and when you oil it, everything is fine, that's not likely, because dandruff tends to run a more chronic course. So if you notice that you're not taking care of your hair, you're not oiling it the way you're supposed to, then once you do that and everything resolves, it's not likely dandruff. It's more of just a dry scalp, which your hairstylist you are fine with that. Even for dandruff, some of the hairstylists, some of them have, undergone a bit of some training. And so for just straightforward dandruff, they can help you with that, with some of the products to tell you to use. Yeah. And for any time you have dry, and when it is seborrheic dermatitis, like that's the dandruff of the scalp, there are some certain shampoos that are tailored towards that. And if you have dry scalp, if you have seborrheic dermatitis, you are that client that you need to wash your hair a bit more frequently than the person that does not have seborrheic dermatitis, because you need to leave some of the products in there for some time for it to act. Then you can wash it off and condition your scalp afterwards. So for the dry scalp, seborrheic dermatitis that is just mild, your hairstylist may be able to take care of that without having to see the dermatologist.
Right. Okay. So the other thing, I think the other part of my question, which I'd like you to touch on, is what's happening inside the body as well. Because in my experience, sometimes, you see a client and you I've suggested to people to eat their vegetables and drink water, and they usually just have some improvements in what they are experiencing. Would you say that there's a big connection, or should these issues just be treated from a topical point of view?
That's a good question. So for dry scalp, usually there's really nothing from inside. It's just the way you're caring for your scalp.
Right.
Then, people have different types of skin, oily skin, dry skin, same with the scalp too. oily scalp, dry scalp, that kind of thing. So the care of the scalp will be different. But when you start to have someone with dry scalp, scaly adherence patches on the scalp, that when you peel them off, you start to see some bleeding. When you start to have patients with hair loss accompanying all these things, and hair loss are different. So hair loss, you maybe just some of the hair is falling off, or hair loss that is all the way to the scalp. You can see that there's a visible, chunk of hair that has left some center of the scalp, or the center of the scalp, or other areas on the scalp. Okay, so there are some conditions that they are associated with, a bit of some most of the causes of hair loss, most of them, when you have hair loss, especially when they are those patchy types, you would have the cause not exactly being known, but it will be a combination of some genetic factors, most of the time some genetic factors, and some environmental factors, and some immunological disturbance in that particular patient. And again, you mentioned some deficiencies. One thing that is common is that a lot of people they take drugs, do all these things, and you rightly said it, that you tell some clients, eat some certain foods, and they get better. Because you realize that even our diet, a lot of people are not eating balanced diet to ensure that they are getting enough for their hair. So to answer your question, there are some certain scalp disorders that when you see that, you will know that there's something a bit more than what is going on the scalp. So a good example is something I mentioned the other time. I mentioned psoriasis. Okay, I'm not sure whether I mentioned it, but psoriasis. So if you have somebody that you are thinking has dandruff of the scalp, but you notice that those scales, they are adherent, and when you try to peel them off, you notice some pinpoint bleeding. This patient might just have psoriasis, and this kind of patient has more than just something going on the scalp. There are some immunological disturbances that are going on. So this kind of patient will need to see a dermatologist.
Right.
Okay, so it's not all, not all hair loss that is just based on the hair alone. But to answer your question again, a lot of time you see hair loss, although there are some immunological disturbances taking place, but it is still limited to the hair.
Right. Okay.
So for example, let me give you another example. Let's talk about something we call alopecia areata. Alopecia areata refers to it's a form of hair loss. Generally, the cause is thought to be something we call autoimmune. When you hear the word autoimmune in medicine, it means that the body is kind of not recognizing its own self properly, and it's fighting against itself, or fighting against some component of that part where the issue is. So in alopecia areata is an autoimmune hair loss kind of that is happening in that condition. And there are different types. So the classic alopecia areata, you have the patient the patient just comes with this bald patch, no irritation, nothing, just this bald patch on the scalp. And it's just on the hair alone. Sometimes you might have it going to the eyebrows. Sometimes you might have it, even all the hair on the body can disappear.
Right.
Okay, so it depends on the kind of presentation that will let you know that, this patient is more than just the hair that is happening to this patient.
Right. Thanks a lot. You brought up something in the conversation, which was where I was leading this thing to. Medication. I think if there's anything the average Nigerian knows how to do is self-medicate. I grew up in a house whereby, everybody is a doctor by medication. I have headache, take this, mix that, do this, do that. And I think what's become quite popular these days is that biotin is touted as a supplement that you should use to grow your hair and get luscious hair. You go to the pharmacies and you see all sorts of supplements that, suggest that they would give you nice hair, strong nails, luscious skin. Are these things generally applicable to everyone? And is there even any advantage into medicating? Are these supplements that you can just take daily that would help your hair thrive and grow?
So let me put it this way. Like you said it, that day, everyone is a doctor in Nigeria. Oh, you have this problem, take this. Oh, you have that, take this. And one problem with us in Nigeria, again, is that if you've not given these patients drugs, they think that you have not done anything. Even when you explain that, you don't need to use this, it's not necessary. So to answer the question, hair supplements generally, there's really, I'm a researcher. And so I will speak in the scientific terms. There's really no substantial evidence now to tell you that, oh, these vitamins are essential for people that have no vitamin deficiency.
Right.
So one of the most popular ones, biotin, like you mentioned. Biotin is also called vitamin B7. Okay, and biotin has been touted for, use. I've had several patients that have been on these drugs, and they go for the high-end ones, the expensive ones, and they can't. They're not eating properly, and they are taking biotin. And when they've taken it for a few months, they now finally seek out the dermatologist. And I'm like, okay, you've taken it for about 6 months. Have you, to be honest with yourself, have you noticed any major difference? And they're like, no, Dr. Gold, I don't think so. So biotin is one of those vitamins. It's actually a water-soluble vitamin. It's one of those vitamins that deficiency of biotin is very, very rare. It's not common at all, except in states like somebody is malnourished. And for you to be malnourished, that means you are probably, you are homeless. You're not eating anything. You're not eating balanced diet and all that. But if you're eating properly, you are eating balanced diet, because biotin, it's present in a whole range of foods, vegetables, in grains, in nuts. A lot of nuts have biotin. Fish, seafood, you have biotin in there, in those foods that I've mentioned. So if you are eating properly a balanced diet, you are very unlikely to be biotin deficient. And what that means is that you actually don't need to supplement biotin. Right. If you are supplementing it, and the average amount of biotin you need in a day is about 30 microgram to 50 microgram, and your diet takes care of that perfectly.
Interesting.
So most of the vitamins that have been prescribed, but the thing is, luckily, there are most of the studies that have shown that, because there are a few studies. If you go on the internet now, you see a lot of articles that have tried to, because for research, you want to answer a question, you give the patient this, and after some time, you look at the degree of hair growth and all that. So there are some studies that have been done, but they are not. We categorize studies in medicine based on the level of evidence. So the level of evidence very, very low. And because they are more of case series, case reports, where you just pull a few patients and you just give them the drugs for some time. And most of these studies have not proven that taking biotin or any of these vitamins would help people that have no vitamin deficiency.
Right.
So it's a different if you have a vitamin deficiency. Another good one I should mention is zinc, for example. So if you have zinc deficiency, and your zinc levels are measured, you have zinc deficiency, of course, zinc would help if you have hair loss due to zinc deficiency. If you have biotin deficiency, very rare. Okay, so to answer the question, not necessary, but a lot of patients will use it, and luckily, there are really no major side effects yet.
Okay, that's good to know.
What did you say?
I said that's good to know. At least we're not hurting ourselves by self-medicating on this particular supplement.
But the thing is, for drugs, generally, if the side effect profile of something is low, the studies that would have been carried out on it, they will not be as much as those things that have a high side effect profile. Right. So what that means is that nobody really knows how long you need to take it for before some side effects start to come up. So what I advise patients is that if it's really not necessary, if you don't have any deficiency, don't take it. But for the patient that, I know that they would even if you don't prescribe, they would, you can tell from the patient when you are discussing with them. So one reason why I don't worry myself much is that a lot of them, they stop it after some time on their own because after buying all the supplements for months and they really don't see any appreciable difference, they just stop. Yeah. And the good thing is a lot of these vitamins too, they are present in food, but if someone is not getting enough from food, there's nothing, you can supplement your diet if you're not getting enough from food. But typically, we recommend that, you try to get everything you need from a balanced diet rather than taking it, as drugs.
Right. I think food is the ultimate supplement.
I tell you, the ultimate supplement. And let's not say food, let's say healthy, balanced diet. Because the kind of food that people take, you realize that you can't get what they need from the food because they don't eat healthy. But if you have a healthy balance, take a lot of fruits, vegetables, take some healthy nuts, almonds, and all that. And I think we're all guilty, because here I am telling my patients to take all these healthy fruits, vegetables, and I have to remind myself that you've not taken your fruits, you've not done this, So I totally understand. Sometimes in our busy schedule and all that, we forget to eat healthy. It's a conscious decision you have to take every single time.
Right. Okay. This is an expert conversation, so I'm actually kind of battling in my head. I'm saying, should I ask some of these questions? It's too technical, but I guess that's the point of this series. How does somebody differentiate from an hormonal imbalance? Because you've kind of educated us that most of the time, if you are eating right and doing the right things, taking care of yourself, washing your hair, doing what you should do, you should be fine. And when you even have issues, if you correct it on that base level, you're okay. But a big problem that I tend to see is things like postpartum alopecia, which basically means hair loss after you've had a baby. And nobody actually really ever talks about all the hair you grow when you are pregnant, because most people grow a lot of hair when they're pregnant. But you find out that there's a lot of hair loss after the pregnancy. A lot of stylists, talk about this a lot, because we get to see it and you get to explain to your clients, have you just had a baby? This is what might be happening. Is that due to an hormonal imbalance? And at what point should it be indicative to both a hairstylist and an individual to go and check their hormones? And what's the best way to go about it? Do you just go for a blood test, or should you actually actively seek out a dermatologist?
Okay, so let's take it this way. So some of those hormones, and the typical history is that you have your patient come to you and say, when I was pregnant, my hair was so lush, so full, and after I gave birth, everything just started to fall off. So some of the hormones of pregnancy, they build up, so you can have your hair growing better while you're pregnant. So when you talk about postpartum hair loss, it actually falls under a type of hair loss that we call telogen effluvium. Okay? Don't worry, I'm going to break it down. So in a normal healthy person's scalp, you have different types of there are different phases of hair growth. So we have what we call the telogen phase, the anagen phase, and the catagen. So the telogen phase of the hair cycle, that is the period of your hair where the hair enters something we call a resting period. And when it enters this resting period, you have some hairs that we call the club hairs that will and after some time, the hair will fall off. The anagen phase, anagen is the period of growth of the hair. And this anagen phase is the longest. In fact, almost all your hair, about 80 to 85% of the hair is usually in anagen phase. So anagen phase is that's the phase where your hair is actively growing from the roots, and it's about 2 to 7 years. So it keeps, and this phase, they grow into each other. Some hairs are in anagen, some hairs are in telogen, some hairs are in catagen. Catagen is the third phase. And this phase, the hair just stops growing and it detaches itself, and that's when it becomes that club hair that I mentioned.
Right.
So in telogen effluvium that I mentioned earlier, pregnancy falls under telogen effluvium. And telogen effluvium just refers to a stage where you have excessive shedding of the hairs that are resting, and after some kind of stress to the system. So remember that pregnancy is considered a stressful state. So a lot of hairs can just go into telogen after pregnancy. Okay? So what happens then is that you notice that when they deliver, the hairs just start to fall off. Okay? And it is not uncommon. And it would resolve on its own, because there's no drug treatment or anything that you're supposed to give for telogen effluvium. The most important thing is and that's why I'm happy that the internet is such a massive place for information. There are lots and lots of information that you can get on the internet. So you know what I do for my patients? One thing is that for patients, when they know that, I'm not alone in this thing that I'm experiencing, I think it makes it better for them. So I give them some sites. So go on this site, go on the internet. You will see that this thing it's not like you are alone in this thing that you're suffering. And after a few months, it's going to resolve. So it's more a lot of psychological talking to the patient. So it's not about hormonal imbalance. It's about the stressful event that has happened to the body, and the hair just goes into that phase where it just stops, growing.
Okay.
So, and those hair will now shed off. Okay? Those hairs will shed off. And there are so many things that can cause telogen effluvium. So you have somebody that has been sick for some time, has been admitted in the hospital for a long time. That person can go, the hair can go, you can have telogen effluvium. Somebody goes through a surgery that is very stressful on the system. Even psychological stress. And that's why you have some mental illnesses. Like, somebody that has anxiety, neurosis, somebody that has depression, they can have telogen effluvium. Okay? Some medications, okay? Remember I told you that some hormones, they help hair growth. So, like when you're pregnant, when the hair is just getting full and all that, when you are using the oral contraceptive pill, when you suddenly just stop, you can have telogen effluvium. Okay, so these are things that when they happen, and you will not have patches of hair loss. You will just you see that the density of the hair, everything just reduces. So, and the hair, more than, normally I say you lose about 50 to 100 hairs in a day. You just see that you are losing way more than that. And it's quite bothersome because it can be really bothersome for a lot of people.
Yeah.
Okay. So it's important to reassure the patients. It's important to talk to them psychologically, because there really is no treatment per se. It's just to wait it out and for the hair to return back to its usual cycle of growth.
That is actually very, very useful information. So far so good. I feel like in my own experience, when you have a client that presents or just come to do your hair, the first thing is to understand what your routine is, so that if there are bad practices, we can eliminate them so that your hair can do better. So I talk to my clients a lot personally to find out, okay, have you just had a baby? So are we dealing with some postpartum hair loss? And one of the cases that presented to me a while back, which was very interesting, was that this lady came and she was experiencing patches of hair loss on her head. I had never seen anything like that before. So I started trying to understand, from a stylist point of view, what might be going on, so that I know the best way to help her. So, I asked questions like, is this hereditary? Have you always had this type of patches on your head? And we kept on going around in circles, and everything she was telling me about her hair care practice seemed normal, until she disclosed to me that she had been kidnapped some weeks before, and she was held for 2 weeks. And to be honest with me, it was after that episode she started to experience this hair loss in that sort of a case. So at that point I was just like, okay, I think you should see a doctor. I'm not even sure which of the doctors you should see now, but something is going on inside you, and you need to kind of figure that out, because this is not topical. This is not, I can't rub peppermint oil on your head and massage it, and I think it will help. You need to see somebody. So in her particular case, what would you think is going on, and who exactly would you think will be able to help in that sort of issue?
But the funny thing is that you actually just answered the question yourself.
Okay.
What you've described that happened to this lady is classic telogen effluvium.
Right.
So she went through a stressful event, okay, and from there she had telogen effluvium. I'm sure if you see that patient months later, the only problem with that is that the kidnap itself, she could go through a post-traumatic stress disorder. From there, have some anxiety issues. So that telogen effluvium may actually run for a longer time than it should. Do you understand? So she has two things that will be causing the stress for her. The fact that she was kidnapped, and probably they were not. That's a stressful event on its own. Right. Then the anxiety and the psychological issues that can follow that kind of event. So from there, telogen effluvium. So that what you just described, she actually had telogen effluvium. So of course you could have given her all the peppermint oil, all the whatever to massage into her scalp. And the thing about, I tell people, okay, let me give you an example. When I'm treating my patients, whatever the condition that they have. So if a patient comes to me now and tells me, oh, let me go to one of the most common skin conditions that brings patients to my clinic, I've got acne. Oh, Dr. Gold. So I recommend a regimen for the patient, and she tells me that, oh, I forgot to mention, Dr. Gold, when I take groundnut or when I take peanuts, my acne becomes worse. Even though in the studies, there are conflicting studies. Some will tell you that, okay, same with biotin. Diet is not really a major contributory factor for acne, except for some particular foods. So sugar, diet high in refined sugars and all that, those ones can be implicated. But things like nuts, oil, they are not, studies have not substantiated that yet. But if a patient comes to me and categorically tells me, Dr. Gold, when I take bread, my acne becomes worse. You know what I tell myself? The psyche has a lot in a lot of conditions. And I just tell the patient, oh, bread makes it worse. Oh, then we found something to look at. So please reduce the bread that you take. And tell you something. These patients, by the time they come back, they'll tell me, oh,
I feel better.
Perfectly, I feel better, I feel this. You know, as long as it's nothing that would harm my patient. So a patient tells me, for example, when I drink warm water, my skin glows. I know warm water is not going to harm her. So, and I know that warm water is not really doing anything to the skin for it to glow. But the patient feels that makes her skin glow. And so, you know that thing of, why are you trying to fix what is not broken? So if it is not broken, I don't try to fix it. So I leave the patient with her warm water and I leave her to take it. So for you, that kind of patient, despite the fact that you tell her that, this thing is something that is self-limiting, is going to get better, you will still give her some oils, that you know that help. Do you understand? That help.
Yeah.
And you give her these things, because if you don't give her anything, you would not have fed her. And she would think that, nothing has been done. And I tell you, those products that you probably give her would make her feel that, I think I'm getting something. The anxiety reduces, and the telogen effluvium resolves faster.
This is
so what I would
very interesting.
Yeah, you have any patient like that has, something that you suspect that is due to stress, don't leave them alone and say, you don't need anything, it's just due to stress, eat well. No, give them, especially if you are talking to a Nigerian patient. Yeah, you have to give them something. And I can speak like this because I'm being okay. Like, for example, when I have my children come up with some skin things and I know that it's going to resolve quickly, I don't bother myself. I know it's self-limiting. But if a patient is coming to my clinic, no matter what you tell them, they won't believe you. So I'll recommend some soap for them, some pH, I'll recommend the good basic skincare for them. So they will know that, Dr. Gold has given me a skincare. And even though I know that thing is self-limiting, they will come back in 2 weeks and tell me that, Dr. Gold, everything resolves immediately. Exactly. So you need to work on the psyche of your patient too when you are treating them.
I like that you're referring to my clients as patients. I'm now a hair doctor, hairstylist doctor. Okay,
Yes,
so since we are talking to a dermatologist, I'm just going to use the opportunity and ask this question, even though it's very hair related but very face related. We do get some clients that tell you things like, please style my hair all up or off my face, because when my hair touches my face, I end up developing acne and all of these things. Is it really possible that someone's face can react to their own hair?
Okay, so let me put it this way. Acne is a combination of different factors. So you have something we call increase. So, and there are different types of acne. But the prototypical acne is the adolescent acne. And so what you have there is that you have, there's the spot, the androgen spot, the androgen that goes up in adolescence. And androgen is implicated in acne. Then you have excess, so something we call hyperconification. The topmost layer of the skin is called the cornea, stratum corneum. So it's like it's shedding. And when it's shedding, it's plugging into the follicles. So anywhere you have a sebaceous, so acne is a chronic disorder a chronic inflammatory disorder of the sebaceous, of the pilosebaceous unit, of the sebaceous unit. The sebaceous gland is that gland that produces oil on the skin.
Yeah.
And that's why you don't see acne in children. It's really not common in children because the sebaceous gland in children, it doesn't become active until puberty. And so and that's why you notice that children, they all have the same kind of face, not oily, everything just looks smooth and all that. But by the time you get to adolescence, you have the oil being produced. So there's a place of genetic factors. It's not everybody that has sebum on the skin that will develop acne. So there's a place of genetic factors implicated in acne. There's a place of sebum production, and this sebum, this excess sebum, along with the skin, that's corneal layer, the conification, hyperconification that I mentioned, they plug the follicles. And when they plug the follicles, the androgen production to the increased androgen production, there's chronic inflammation within this follicle. And there's this thing we say in Yoruba that when something pushes you down, when something small pushes you down, or when something big pushes you down, other smaller things will come and build a house in that place. So when your follicle, when it's all congested like that, there's a particular organism, it's called Cutibacterium acne. It tends to thrive within that environment. And so it also contributes to the chronic inflammation that is occurring within the follicle. So again, like I mentioned that there are different types of acne. There's one we call comedogenic acne. So if you have a lot of products in your hair and your hair is touching your face, when those products, and especially if you're somebody that has acne prone skin, when those products are getting on your face, that's forming like some sort of debris and you are plugging your follicles further. Right. And that's why you would see us tell our patients, don't apply, some patients would think that until I apply all the hair cream on the front of my scalp and all that, that's when I've applied, that's when I've oiled my scalp. As much as possible, you don't want all that oil in front of your face. Another thing again is that, especially for people that are breaking out actively, the hair itself can irritate the follicles. So it's most of the time, especially when it is synthetic hair, you can have those ends irritating the follicle. So when you are breaking out actively, I advise my patients to have your hair, back, not irritating your follicles. You don't want to, because there's also something called mechanical acne. So it's called acne mechanica. So with friction, you can have irritation of that follicle and you can have acne-like lesions coming up. So it's best that when you have a patient that is genetically predisposed to having acne, or a patient that has a lot of acne on the face, you leave the hair away from the face.
Right.
It's best to do it. But one problem, when you are leaving the hair away from the face, another thing that people do wrongly is that they tend to pack their hair so tightly. And that's a lot of traction occurring on the scalp. So you're not going in a bid to take the hair away from the face. I tell the patients, don't make it so tight.
That you start losing your
pack
edges.
your hair so tight, where you now start to have traction alopecia or traction hair loss.
All right.
Okay.
Thank you so much for the insights on that. Believe it or not, we've already been talking for over 14 minutes. And
way.
Yes, we have. I would like to bring up a topic that I would accept from the beginning of bringing this up, that I do have a bias, but I want to know purely just from a medical point of view what we might be doing to ourselves. I am on Instagram quite a lot because, the business right now, basically your business is run by social media. And I tend to see that the new wave with the wigs is to glue it onto your head. I don't have this personal experience. I probably know that you don't. But from a doctor's point of view, are there really safe products? And I bring this up, I think I brought it up in a previous episode, but I bring it up partly because we do get clients that want to lock their hair, are not comfortable with how the locks look in the early stages, like we said earlier, and are looking to see if they can still wear their wigs. So this is not trying to knock people who wear wigs and weaves, but this is basically saying, okay, people with locks still want to do these things. Is it safe for you to glue these frontals to your head? Is that something we should worry about? Are those products really safe? The whole idea of it for me looks terrifying, but what do I know? I've been locked for 12 years now. So do you have any opinion on that, especially from a medical point of view?
I don't even think we need to go medical. Anything where you are gluing something and you need to start pulling it off cannot be, And that's why I see that a lot of these products, they tell you that this is very mild. And one thing a lot of people do wrongly again is that, some of these weaves, And Yoruba adage, there's one Yoruba adage that says, "Bowo se mo logun mo," which means that the more money you have, the better the kind of products that you are able to get. Okay, so some of these wigs, they come with the glue that comes with them, very light, but still, it can still catch on your scalp. And when it catches on your scalp, pull your hairs out. And so that's form of, you're creating an iatrogenic. Iatrogenic means something that you're causing for yourself. So at the end of the day, when it comes to the wig wearers, the people that are using glues, I think for them, they've accepted it that, okay, if I perish, I perish. How did they say it in Nigeria? If I lose my hair, I lose my hair. I cannot be seen going about with, I don't want this natural hairstyles on my hair. And like you said, to each his own. So what I tell my patients, I tell them that, see, you would, if you keep on, and I have a lot of them in the clinic, after putting all this glue on their head, and I even saw one on Instagram, put glue on the head and the whole scalp just went out.
Ooh.
So it actually causes a form of iatrogenic alopecia. When you, and a lot of people, I've seen people that in years, they've not left their hair alone. It's just those glue. They keep putting it there and keep, the frontal, and to be honest, I don't really understand a lot of those terms, but they've not left their own hair in years. So a lot of them, and remember one thing again with hair, genetics play a huge role in the kind of hair that you have. So for example, let me use myself as an example. In my family, genetically, we don't really have full hair. We're just normal hair. But you would meet some people that in their family, they are used to, they have luscious, thick hair. You understand? So for those kind of people, even when they are gluing the hair and all that, even when they lose hair, it's not so obvious. But if you are the kind of person that naturally your genetic makeup, you don't really have, your hair is, maybe instead of 100,000, you have 20,000. But that's just being funny. But naturally, you don't have. Hello, Ade, are you still there?
Yeah, I'm listening.
But naturally, your genetics, you don't really have a lot of hair. Then that means that with the glue and all that, you tend to even lose hair more. So to answer your question, not recommended to be gluing your hair and all that. And especially when you have gotten so used to it, and it gets to a point where I don't know if I mentioned this, that when we are dealing with scalp disorders for a dermatologist, we talk about scarring hair loss, non-scarring hair loss. When you hear the word scar, that means that something we call fibrous tissue, that means a scar has replaced the place where the follicle is. Right. And if you take a look at your skin right now, Ade, you see that you have like tiny holes on your skin, especially where the hair is coming out from. That's the follicle. That's where hair comes out from. Hair erupts from that follicle, and your hair comes out from that follicle. If you have any disease process that causes that follicle to become scarred, hair is unlikely going to grow back from that follicle on its own again.
Right.
So when we are managing patients, we talk about scarring alopecia, non-scarring. From what I've explained, you see that patients that have non-scarring alopecia, they have a better prognosis than people with scarring alopecia.
Because the hair might never grow back. There are
different types. What did you say?
I said the hair might never grow back with the scarring one.
Yes. And and it now depends on when the patient presents. So, for example, a patient with a scarring type of hair loss. Let me give you an example of a scarring type of hair loss. There's a condition we call discoid lupus erythematosus, DLE for short. So, I'm sure you've heard of systemic lupus. You've heard of lupus before.
I've heard of lupus.
So, there's a type of lupus that oftentimes it's localized. Might be on the scalp, might be on the face, might be on the ears. So, that's discoid lupus for you. So, if the patient presents early in the disease, it's easy to manage. So it's just like the popular saying of a stitch in time saves 9. So if the patient presents early, the management is better. The outcome is better. But by the time the patient presents, which is the typical way most patients in Nigeria present, they would have gone everywhere but to the doctor's place, and they would have used everything but something recommended by the doctor. And in the process of even using things, they would have used corrosives on their scalp, and further scarring the follicle. And so by the time they are coming, everything is all scarred up. So to answer the question of the glue, initially when you start to use it, maybe you're losing your hair, a form of non-scarring hair loss. If you're not careful, there was a lady I saw on Instagram, you would cause a type of scarring hair loss for yourself, especially if you're using those glues that are really strong. So it's really not recommended, but for a lot of people that wear wigs, there's nothing they will tell you that this is the way I want to, leave my hair. And a lot of them also put this band on their hair that constricts the whole scalp, almost like you're not allowing the scalp to breathe, the blood flow to the scalp itself. And the wig is so tight and all that. But I think at the end of the day, most people will do what they really want to do with their scalp. Ours is to educate and to enlighten people when it comes to the hair and the scalp.
Yeah. Wow. Okay. We have gone full circle with this conversation. I've enjoyed where it's gone. You have used a lot of technical terms: talogene, anagene, catogene,
But did I try to break it down?
You did. I'm just a lot more intelligent person right now. I've just done a crash course in hair dermatology. So
it's a diploma already.
Yes, I've just had a diploma myself. And, time is fast spent. I know I'm going to have to let you go because you're very busy. But before I let you go, I would like to talk to you about some of the things that are happening for you personally. I do know that you are publishing a book very soon that's about to launch. Can you tell us a little bit about that so that our listeners can know where to find you and find the book when it comes out?
Yeah, thank you so much. So, apart from I think one way a lot of doctors, we tend to, especially in Nigeria, we tend to live confining lives. We're not living wholesomely. So apart from being a dermatologist, I also enjoy writing a lot. And I think it is one of my innate gifts. A lot of people tell me I write quite well, and I've been writing for close to 6-7 years on social media. And I have a website, I have a blog on that website and all that. So I thought to myself, it's time to use your gifts, to help. And one thing I'm seeing these days, I'm seeing that a lot of doctors, they are becoming disinterested. The passion is not there anymore. And it's not just doctors, a lot of young adults. And social media has not made it easy. I think especially social media that has to do with pictures. Now I'm talking about Instagram. You see a lot of things and you feel that, I'm not doing well. I'm not at par with my colleagues and all that. And one thing I've realized is that living a wholesome life is about not just your career. It's about managing your life totally holistically. So I wrote a book, and the book is called MediThrive. Although the book says MediThrive, it's a book that I tailor towards young adults, adolescents, people that are just, that are in their career trying to understand how to ensure that they are living wholesomely and how to ensure that they are making the best out of their lives. So it's not like I'm saying that I'm the best or I've got my life all figured out. But when I did residency, I finished in 2018. That's 3 years ago. So I'm one of those people that you say everything was just, I did my medical school, my residency, house job. I never had any break. So I did it in record time, and I still have time to do a little bit of other things, which like I'm doing right now. So I felt that writing, they say experience is the best teacher, but really you don't have to experience something before you talk about it. Yes. So I went to my colleagues, a lot of them that I know that they are thriving, not just in their career, but generally living a wholesome life. So the book is divided into like 10 chapters in the first part of it, into different rules, talking about how you need to know yourself, how you need to be emotionally intelligent, how you need to build your social capital, how you need to, if you're a versatile person, how you need to harness your strengths, how you need to, associate with the right people to ensure that you are living a wholesome life. And the second part of the book is divided into 8 or 9 chapters where the contributors in the book, the other doctors that I mentioned, they wrote chapters in the book. So it's a book that honestly, I when you say, you look at yourself and say, Shaki, you've done a good thing, so I feel very good with myself. So right now I'm doing pre-orders for my book, and it's on all my social media platforms. You get a link to go to the website to order the book, to pre-order the book. I'm doing pre-orders for people in Nigeria. The book will be on Amazon by before the end of next month. So my social media handles, at Skin and All on all social media handles, at Skin and All _ at Skin and All on Facebook, Instagram, Twitter. I have a page on Facebook. My website is www.skinandall.com. And I also have personal pages, Shakirat Gold-Olufadi on Instagram and Facebook. So so that I don't spend all time talking about my book.
No, well, thank you so much. I'm actually quite sad I have to go because my crash diploma course is ending, and I feel like if I had you for like 2 more months, maybe this diploma would be authentic, because right now it's just a crash course. But thank you so much. You're one of the people I've really enjoyed meeting in person, and I enjoyed starting your locks and seeing your hair grow and seeing your journey grow. And I remember specifically, I think maybe almost about a year after you got them done, you sent me a picture of your hair just done, and I sent you a picture of the first day or something, and you were like, it has grown. So it's been a pleasure to have you on the podcast, like I said. And thank you so much for making our time. Be rest assured, I'm going to be reading your book, and I'll be giving a review when I get to read it. So
thank you so much.
This has been interesting, and I think first, to just wrap it up, a healthy, balanced diet is the first place to start to be able to get your skin and hair healthy on the basics. And when in doubt, seek out an expert, seek out a dermatologist. Don't try and put all sorts on your hair. Thank you, Shakira. I got to let you go.
Thank you, Ade.
Yeah.
Thank you so much.
This was a good one.
I actually really enjoyed it.
Same here.
I'm glad I did it.
Same here. All right. Thank you, and have a lovely rest of the day.
You too, Ade. Yeah. Bye.
Bye. If you ask me, a few things to remember though. A balanced diet goes a very long way to maintaining healthy hair. And the brain contributes to how we may feel and perceive ourselves, and also heal ourselves. Positivity helps. It's been a few months since we recorded this episode, and Dr. Shakirat Gold-Olufadi is now a published author. Her book can be found on Amazon and on several of her social media handles at Skin and All. It's spelled at SKINANDALL, Skin and All. The book is called MediThrive. I have ordered a copy and I'm looking forward to read it. This officially brings us to the last episode of the Meet the Expert season, and I hope you have enjoyed it as much as Shakira and I did. Thank you so much for tuning in and listening to the Talking Locs with Locitude podcast. It has been such a pleasure being your host. My name again is Ade Balogun, and many thanks to our producer, ETheMasterMind. Please don't forget to follow us on social media. We are at Locitude, LOCITUDE, and you can also find us on Facebook, Instagram, and Twitter. Well, there are so many episodes and so many ideas that are going to be coming soon, and I hope you stick with us. I'm going to be asking questions like why? Why do we feel a certain way about our hair? How did we get to the point that we have gotten to, and how locks have evolved over the last few years? These episodes are going to be interesting. I'm going to be telling stories of lock heroes, and I'm going to have people on to also answer questions that we may have and just feel our perspective on things. It's going to be fun. So don't forget to subscribe to our podcast. We are currently on Apple, Google, Amazon Music, Spotify, Stitcher, and Deezer podcasts. You can also find us on YouTube and on our RSS feed. We are the Talking Locs with Locitude podcast. Well, there you have it, and don't forget to keep it locked with an attitude. Bye.